going to show you the room. Show you my card and then back and putting face down. Okay. Hello, my name is Michelle and I'm a student at South College and I'm going to be doing an assessment on you today. I'm going to start off by closing the curtain and washing my hands to provide privacy and washing my hands. Can you tell me your name and date of birth?
Kelsey Overstreet, July 25th, 1994.
And can you tell me where we are?
South College.
And can you tell me the year?
2020.
Patient is alert and oriented ×3. Looking at my patient, she appears to have good hygiene. She appears to have good nutrition. Her skin is normal for ethnicity. She has good mobility as she was able to walk into the room. Her mood is pleasant and her stature is standing up straight. I'm going to go ahead and look at my patient's head, start with my head. Looking at her head, it is normal cephalic. There appears to be no lumps or lesions or redness. I'm going to go ahead and feel your head and let me know if there's any pain or tenderness. Any pain or tenderness here?
No.
How about here?
No.
Patient denies any pain or tenderness when I palpate the head. Looking at the face, would you be able to close your mouth, like clench your mouth, and then would you be able to clench your eyes and raise your eyelid brows? And can you stick out your tongue and move it from side to side? And can you puff out your cheeks? The patient was able to perform all tasks, so cranial nerves 7 and 12 are intact. And then I'm going to go ahead and, what am I going to do next? The cranial nerves, the 7 and 12 are intact. Then that completes the head. I'm going to go ahead and move to the ears, looking at my patient's ears. Well, first actually I'm going to look at her nose, because that's the part of the face. Looking at my patient's nose, it appears to be midline. I'm going to ask you to test for patency. I'm going to have you close one nostril and breathe in and out. And can you close the other nostril and breathe in and out? All right, patient was able to perform that, so there is patency. I'm going to have you tilt your head back, and I'm going to look up your nostril. And looking at the nostril, there appears to be no drainage, and the septum is midline. Looking at my patient's ears, they appear to be even. There is no redness or abnormalities, and there's no lesions. I'm going to go ahead and feel your ears, and you let me know if there's any pain or tenderness. Any pain or tenderness there? Any pain or tenderness here?
No.
Okay. Patient denies any pain or tenderness when I feel her ears. I'm going to go ahead and lift on your ear canal. I'm going to pull up and back. And looking down, see. Okay. And on this side. There is a little bit of fluid, but there is no drainage in her ears. I'm going to go ahead and feel your pre and post auricular nodes, and you let me know if there's any pain or tenderness. Any pain or tenderness there?
No.
Is there any pain or tenderness there?
No.
Patient denies any pain or tenderness when I palpate the pre and post auricular lymph nodes, and they were both non-palpatable. Okay, moving on, I'm going to move on to the eyes. Looking at my patient's eyes, they appear to be, there's no redness, the sclera is white, and the pupils appear to be about 3 millimeters in size. I'm going to go ahead and pull down your eyelid and see if that's the sclera. And then the conjunctiva is clear. Yes, I'm going with the conjunctiva. It is clear. And then I'm going to go ahead and shine a light in. Now, first of all, I'm going to have you follow the top of my pin with just your eyes only. And if you go look, follow it. Right, patient was able to perform all movements. I'm going to have you look right over my shoulder. I'm going to shine a light in your eye. All right. The pupils were equal and reactive to, they were round and equal to light and accommodation. Round and equal, yes. So there is present, and with patient was able to perform all movements, so cranial nerves 3, 4, and 6 are intact. And then that should complete the eyes. Looking at my patient's mouth, the lips are red, and moist. There are no lesions or lumps or abnormalities present. Going to have you go ahead and open your mouth, and I'm going to, can you say ah?
Ah.
All right. See my patient's mouth, all the teeth are present, and there is no chipping. The gums are red and moist. The uvula was mobile when she said ah, and there, the tonsils were a grade 1. Moving on to my patient's neck, it appears to be straight and midline. The skin is normal for ethnicity. There are no pulsations notable. I'm going to go ahead and feel the cervical lymph nodes, and you let me know if there's any pain or tenderness. Is there any pain or tenderness here?
No.
Any pain or tenderness here?
No.
Okay. I'm going to go ahead and feel your carotid pulse. Let's do it one side at a time. Okay, on the other side. Okay. Pulse was palpable, and the rate and the rhythm were steady. Would you be able to look down? And then can you look up and back? And can you tip your head side to side? Okay, and then can you push against my hand? Push against my hand, back and front. Okay. Patient's neck range of motion is full range of motion, and she has good strength in her neck. Moving on to my patient's chest. The skin is normal for ethnicity. Looking at the patient's AP diameter, it appears to be, it's a 1:2 ratio. And then the shoulders and the muscles are, the shoulders and the muscles are midline and they're straight. And I'm going to go ahead and listen to your lungs, and I'm going to have you breathe in and out really deep every time I place you my stethoscope, and you let me know if you need a break. I'm going to do this side. I'm going to do this other side. Okay. I'm going to go ahead and move the camera for a minute. To the back. Okay, there we go. Patient's lung sounds were clear, and all lobes are clear and auscultated. Going to go ahead and feel the lymph nodes underneath your arms, and you let me know if there's any pain or tenderness. Any pain or tenderness here?
No.
Right here?
No.
Any pain or tenderness here?
No.
And right here?
No.
Patient denies any pain or tenderness with the axillary lymph nodes. And I'm going to go ahead and listen to your heart. I'm going to start with the aortic valve. The pulmonic. And the Erb's point. And the tricuspid. and the mitral. Okay. Lungs or heart sounds S1 and S2 were heard on auscultation. There were no splitting or murmurs present, and the rate and the rhythm were steady and equal. Okay, I'm going to go ahead and have you lay on your stomach. I'm going to look at your abdomen. Here, you go ahead and lay down. And I'm going to go ahead and look at my patient's abdomen. The scan is normal for ethnicity. I'm going to bring this camera up so you can see. Patient's skin was normal for ethnicity. It is round, it is flat, and the umbilicus is midline. And I'm going to go ahead and listen to your vowel sounds. I'm listening in the right upper quadrant, in the left upper quadrant, in the left lower quadrant, and the right lower quadrant. There were vowel sounds, and they were normal active on auscultation. I'm going to go ahead and do feel really light, and you let me know if there's any pain or tenderness, okay? I'm going to feel in the right upper quadrant. Is there any pain or tenderness there?
No.
Left upper, any pain or tenderness there?
No.
And left lower, any pain or tenderness?
No.
And then right lower, any pain or tenderness?
No.
Okay. Patient denies any pain or tenderness with light palpation. I'm going to go ahead and do that the same thing, just a little bit harder. And let me know if there's any pain or tenderness. Any pain or tenderness?
No.
Any pain or tenderness?
No.
How about here?
No.
How about here?
No.
The patient denies any pain or tenderness on deep palpation. We'll go ahead and sit up. Yeah. Okay, now I'm going to go ahead and have you do a few tests for me. Going to see if you can touch your nose and then touch my finger with your finger. And then nose to finger, nose to finger. And you switch hands, and then nose to finger. Good. I'm going to go ahead and have you touch your index finger to your thumb, and then you do next finger, and then do that faster and faster. Good. And the next test, I'm going to have you put your palms down on your thighs, and then are you able to flip them over, and then back over again, and to keep doing faster and faster and faster. And I'm going to put the heel of your right foot onto your left and down your left shin, and then heel on your left foot down your right shin. Good. Okay. And then I'm going to go ahead and lightly touch on different areas, and as you close your eyes, and then you let me know if you can feel. Okay. You feel here?
Mm-hmm.
You feel here?
Yes.
Feel here?
Yes.
You feel here?
Yes.
You feel here?
Yes.
Feel here?
Yes.
You feel here?
Yes.
And here?
Yes.
The patient was able to feel on all areas. I'm going to have you stand up, and then we're going to test your balance. And I'm going to have you put your feet together and your arms on your side. And then you're going to close your eyes, and I'm going to stand here and make sure you don't fall. And then see if you sway at all. Okay. Patient's reverse test was negative. I'm going to have you bend straight forward. I'm going to see if your spine is straight. Okay. Patient's spine is straight and normal. And I'm going to see, can you bend side to side? And then can you bend front and then back? Right. Patient's spine has full range of motion. And then I'm going to have you walk across the room. Let's walk normally, and then walk back on your heels.
Oh, sorry, I'll do it.
And then can you walk back on your heels, or toes? Yes. Very good. I'm going to have you go ahead and sit back down for me. I'm going to believe that completes my assessment. I'm going to go ahead and look at my card. Alright, I am going to go back. I'm going to go ahead and feel your sinuses on your face, okay? I'm going to feel, and you let me know if there's any pain or tenderness. Pain or tenderness there?
No.
Any pain or tenderness here?
No.
Okay. Patient denies any pain or tenderness on the facial, the maxillary sinuses. I believe that completes my assessment.